For an asthmatic who has exercise-induced symptoms, what advice do you have for recognizing and managing those symptoms while staying active?
Well, many people get so used to taking an inhaler before exercise, they just do it as rote. However, I feel that if you get really good control, you probably don't need to be taking that medication before the exercise. So again, first thing is control. Take your controller medication regularly. Get your lung function measured at your clinician and make sure it's as good as it can be. See if you really need to be taking something before exercise. And we'll come back to those different medicines shortly. Some symptoms are a little less clear. An example is one. I had the occasion to meet an Olympic winner in Portugal. Her presentation as a younger child was one of fatigue, not so much shortness of breath. And in fact, it took a while for them to make that diagnosis of asthma because it was a bit of an atypical presentation. And certainly not the first thing I would think of as a family doc if someone comes in saying they're tired. What do you do when you have other illnesses? If you've got a viral infection or another trigger, or the air quality is very poor that day, you're familiar with Air Quality Health Index and you can look that up. If you've got a viral infection, if it's a bad pollen season and you have allergies, maybe that's not the time that you pick to do a long exercise with all that extra exposure that you might have. And if you do need to use a rescue when you're exercising, I don't mean prevention, but as for symptoms, it's okay if your symptoms are completely resolved with a rescue inhaler to go back to the exercise. However, if they return right away or if they do not resolve entirely, that you probably should take a break. You might be going into an area where you might get into trouble. Take a break that day, get looked at, discuss it with your doctor about how you're going to manage that in the future.